Hi, it's Dr. Nathalie, and the What the Heck podcast will be starting in 5 minutes. Whether you are watching us on Facebook, YouTube, or Periscope, please go tell your friends because they will not want to miss today's show. I will see you in a few minutes. I'm Dr. Nathalie Beauchamp, and this is What the Hack, the podcast that dives into what the heck is going on in the world of health and well-being, explores how to optimize your mindset and your lifestyle, and shares practical tools so that you can achieve your fullest potential. Join me and a special guest each week as we discuss everything from biohacking to diet personalization to cutting-edge detox methods to setting and staying accountable to your goals. Ready to find out what the hack you can do to stay healthy, sharp, and at the top of your game? Let's get started. Hi there, this is Dr. Nathalie Beauchamp, and welcome to the What the Hack podcast, the podcast where every week I interview a health expert or someone that is going to teach us and help us on hacking our well-being. So today I'm super excited to have a very good friend of mine, Dr. Hazel, and today we're going to talk about how we can use HRV, which stands for heart rate variability, to enhance our performance and our well-being. So Craig, welcome on the podcast. It's awesome to have you on.
Oh, I'm so excited to be here this morning, and thanks for having me.
That's great. I'm excited. I'm always, you and I always have great discussion about what we do as chiropractors and how we can help educate patient on the power of the nervous system. So that's kind of why we chose the HRV, because it's a tool that's not known too much. But first of all, tell us a little bit more about you so our listeners can find out more where you're coming from, kind of thing.
Oh, sure. Yeah. So I am a family and pediatric wellness chiropractor here in Kanata, Ontario. We've been in practice here for 12 years, and we're having just a lot of fun. We see about 30% of our practice is children. We see families, and we work inside of the type of office where 70% of our patients that are coming in to see us are not here because something's wrong with them, but rather they're here because they want to get well and stay well. So, different than most traditional types of chiropractors, we focus on neurostructural correction, and we see a lot of children, like I said, in our office, but that can range anywhere from children that are on the spectrum to children that just literally want to express themselves at the fullest potential that they possibly can. So we've been doing it now for 12 years. I've got 2 staff members and just having a rockin' fun time. So.
Cool. And that's what we're going to sort of focus on today. But
yeah.
As you know, the name of the podcast is What the Hack. And it's kind of twofold why I chose that title is that, I think every expert in their industry or the field of expertise have something that makes them go, what the heck? Meaning what, gets you revved up a little bit that you wish people knew. And then we're going to move on to talking a bit more in detail what is HRV, but what makes you go, what the heck, Craig?
Oh, when it comes to being a healthcare practitioner and practicing every single day and seeing some of the things that patients come into our offices with, or some of the advice that they've been given, I could probably talk for hours. But, one of the things that I've learned over the years is that 2 things hurt people's health more than anything, and that's arrogance and ignorance. And not to be a negative slight on it, but what it means is that when people think that they know everything that there is to know about a certain situation or a certain condition, a certain problem that they have, that they completely tune out anything and don't even look at other future possibilities. The other part is ignorance, where they think they just don't know, right? And that's really kind of on our job, is that we have to help them to understand and navigate this. Really, it's a minefield in the terms of healthcare, because there's so much misinformation that is put forth. I always tell people when they say, to be quite frank, when I tell them that I'm a chiropractor, they have a mental file on their mental hard drive of what a chiropractor is. Mm-hmm. And they think that chiropractic is reserved for those with back pain and neck pain. And we do a fantastic job with that. But the thing that makes me go, what the heck, is the lack of understanding and knowledge about how much more we offer in terms of allowing people to express themselves at their fullest optimal potential, mm-hmm. and allowing them to adapt better to the world that they have stress in. Like every single day they have stresses, and what chiropractic offers them is the opportunity to consistently move towards optimal efficiency.
Yeah, I had a staff years ago that she put it so beautifully. She says, "Oh, I so wish we could bottle how well inside and how well a person should feel, because she said it would be game over, that everybody would want that." So it's hard for us because we're passionate. We see it day in and day out. And, of course, we're chiropractors. It sounds, we're just want to promote what we have. But I was just on the phone before this podcast trying to explain to a mom whose kid has allergies, eczema, and gut issues at 7 years of age. And, she had no clue. And that's what you said, people don't know what they don't know. And that's why, I wrote the book, Hack Your Health Habit, because what is a hack is finding a better way to do things and a more efficient way to do things. So you and I just, like you said, we're a teacher. Our job in the office is not just to deliver an adjustment and correct subluxation. It is truly to be, I see myself, and I'm sure you do too, as coaches to our patients, because every time they come in, we have wisdom to share.
Yeah,
So,
just to add to that, I tell people, I'm like, the adjustments are free. What you're paying me for is tuition. I'm going to show you how to live a better life, and I'm going to give you tips and course corrections to help you just make sure that you're consistently moving towards optimal health. So
yeah, I like that analogy. It's awesome. So let's talk about heart rate variability, because you and I use this tool in our office. I have for, I think 8 years. And I have to say, it's become the hub of the tests that I use in my practice to measure overall health and well-being, and allow me to explain to patients the parasympathetic system, the sympathetic system. So I'll let you just dive in onto what is HRV and what are those two types of system we're talking about here.
Yeah, sure. So heart rate variability refers to the natural rhythms of a beating heart. So when the heart is beating, we know that if somebody says they have a 60-second beat per minute heart rate, they truly don't have one beat every second for 60 seconds. What they have is an interval time between each and every beat of their heart. Now that interval time fluctuates, and it should fluctuate. That's what creates the variability of the heart rate. And the reason why that's important is because you have two divisions to your nervous system. You have a sympathetic side and a parasympathetic. Now, for ease of understanding, the sympathetic side is your gas pedal. It's the part that revs you up. So when you get up and run for the bus, your sympathetic nervous system is actually going to drive your heart rate up. It's going to drive your blood pressure up. It's going to drive your stress response system to make sure that you are able to push blood to your muscles so that you're able to carry sugar to all the different parts of your body that need it. It just moves all the stress hormones around your body. Now, the parasympathetic, conversely, is like the braking system. It's the part that slows you down. Now, one of the most important nerves in your entire body, in fact, the most important nerve in your entire body, is called the vagus nerve. And the vagus nerve lives right up at the top part of your neck, right at the base of the brain. And its job, it literally connects to almost every single organ system in your body. And its number one job is to slow down the nervous system so that you can rest and digest. You may have remembered that from high school, is that the sympathetic is your fight or flight system, right? And then your parasympathetic is your rest and digest, your growth and development. Now, the interesting thing is that when you look at something with heart rate variability, you're measuring the fluctuation of how those two systems are working together, like kids on a teeter-totter. And when you're sitting at rest and balance, both of those should be in a state of balance. And what we test for on the on the heart rate variability, using the pulse wave profiler in our office, is it's a very simple tool that is measuring the interval times between the beats of your heart. And it gives us an understanding of whether or not your nervous system is skewed towards your sympathetic gas pedal side or more towards your parasympathetic brake pedal side. And the relative importance of that is because it's an indication of how well your nervous system is adapting to the stresses that you go through every single day of your life.
And let's face it, I love that you pointed the fact that when I say to patient heart rate variability, I think the first thing that comes to mind is you don't want your heart beat to be variable, but we're not talking about your heartbeat per se. We're talking about in between beats, and it is, the more variable it is, the more you can adapt. And let's also face it, the software we're using will kind of put people in different quadrants, and green is in the bullseye, and that's where you want to go. And that tells us that the patient has a lot of reserve and can adapt to their environment. But let's face it, I don't know about you, but most of our patients are in the sympathetic dominant and overdrive, right? Because it's just this go, go, go. And so forth. So what would you say, you get the most of in your office, the higher left or the bottom left? And I'll explain to our viewer here that the left of our graph that we're talking about, I wish I had a visual, but it's the sympathetic dominance. And let's say athletes, sometimes they will be on the sympathetic dominance, but they're still high. So that means that they have some reserve. It's when we start seeing people on the bottom left, meaning still sympathetic dominant, but now that gas pedal that you're talking about is in effect. And then if the brake pedal is on, then we know that they've depleted this reserve. And I just find it such an amazing educational tool for a patient. And then we can have a good discussion of what's going on in your life, what's your lifestyle like. So how do you take it with your patients, Craig, when you start discussing that?
Yeah, so an analogy that I like to use, and I use often, is let's say that you have a wastebasket, and a wastebasket has a certain capacity to handle a certain volume of trash before it starts to spill over. You and I have a certain capacity to handle a certain amount of stress in our lives before it starts to take its toll and we start to have a crisis. And typically what it comes down to is it comes down to a health crisis. So let's say that we meet somebody, and I would say that 75 to 85% of people are more skewed towards the sympathetic side. And when I say that, it's actually what we're finding is that they actually have a down regulation, or they have a lack of proper parasympathetic control. What's happening is their nervous system is switched more towards the sympathetic side, but the brakes are not getting pumped. So think of driving down the highway with your foot trumped on the gas, and you don't have the ability to slow the system down and to slow down the vehicle, and you're having to weave in and out of traffic. So back to the wastebasket. Let's say that somebody comes in and they've got 7/8 of their wastebasket is full of trash, and they start adding more stress in. Now, stress, we have to think of it in terms of the 3 dimensions. Most of us, when we hear that word, we think of the mental, emotional, right? But what I tell people is that if you're an athlete, well, you're adding a lot of physical stress to your nervous system, right? And if you're not fueling the body with biochemical, or you're adding maybe more biochemical stress, any one of those 3 can start to add more to your wastebasket. And if you don't have much reserve left, then it doesn't take very much for you to start to spill out and start to be faced with a health crisis. Now, that health crisis could be low back pain. It could be neck pain. It could be a challenge with your ability to sleep, to provide energy for your body, to be able to do just about anything. And so the heart rate variability is a conversation changer, because it looks for and identifies hidden problems and even obvious problems within a patient's health history or even their lives. So when they come into our offices, they're going to get almost a synopsis of what their overall ability is to adapt to the day-to-day stresses of their life.
Well, that's great explanation. So let's talk about some hacks, because we talk about well-being and performance, and this is, at the end of the day, this is all what we want. We want to be happy and healthy. We want to be working, full cylinder kind of thing. So give us 3 or 4 hacks that people can implement to make sure that they're giving their body all the tools to be in that reserve spot, to be in that balance between their sympathetic and their parasympathetic nervous system.
Sure. So, I have to say that the number one thing and the foundational principle is you have to make sure that the system that is running and governing your entire body is functioning well. We get our heart checked, we get our stomach checked, we have colonoscopies, we have all these different tests done. But the one that has failed to be checked the most is the nervous system. And that's where chiropractic shines. Whereas everything, every other discipline is focused on trying to care for the end of the issue when the crisis has already happened. Chiropractic, using the technology such as the pulse wave profiler, allows the conversation to be switched more towards how efficient is your overall balance, how efficient is your sympathetic parasympathetic function, and how efficiently is your body operating every day. So number one is get your nervous system checked by a chiropractor that utilizes technology to understand the function and health of the nervous system. The second one I'd have is one of the best and most fundamental ways that you can actually start to activate your parasympathetic system is simply to move more. When you're not moving a lot, when you're sitting at a desk all day, and largely people sit probably 70 to 80% of their day, that causes sympathetic stress in a very quiet, insidious way on their nervous systems. So moving more. Now you'll notice that I didn't say exercise, because when we think exercise, we think that we have to have some sort of structured type of program. And what I'm saying is just move. It could be simple as stretching. It could be simple as yoga. It could be walking to the bus and taking an extra set of stairs, whatever. Just move more. That's all we simply need to do.
Right, I'm going to get you to go back to your number one, just in case people are trying to make the connection. So, we know that the nervous system controls every cell, tissue, and organ in the body. The spine protects it. So how do you explain our role as chiropractor in balancing that system if people don't know what it would mean?
Yeah, great question. So go back to that conversation that we had about the vagus nerve. What chiropractic adjustments have been shown to do, and actually shown to do better than exercise, better than changes in your nutrition, better than changes in meditation, is it has been shown to activate and increase your polyvagal tone, meaning that it's allowing your vagus nerve to do its job properly, which means pumping the brakes and allowing your nervous system to get back into a state of regulatory balance. Through each and every adjustment, it has been shown to have an activation of the parasympathetic nervous system and a downregulation of your sympathetic nervous system. Now, you combine those consistent chiropractic adjustments over a period of time, and that starts to lead to an increased efficiency in someone's overall health and well-being.
That is so powerful. And this is why you and I are so passionate about what we do, because we see it day in and day out, the effect that it has. And I always say chiropractic doesn't cure anything. Right. The body does. And if we allow it to, like you said earlier, express itself, we're just giving it all the tools to perform better. Cool. So what was
the other thing I was going to add is that if you don't know where you are, then you can't tell which way you're going. So the tools also allow us to measure, monitor, and adapt one's care so that we can understand exactly how their bodies are doing with the rigors and stresses of their lives, and how things change. Because let's face it, jobs change, relationships change, new stresses are added to the mix. And so then through chiropractic care in a wellness model, it allows us to be able to help that person function at their best through the times of trials and tribulations in their lives to when they're celebrating and performing at the peak of their game. So it's an opportunity for people to function and be their absolute best.
Yeah, and I love that saying, we don't guess, we test. And it's a powerful thing. And we're used to it within the traditional medical system to get checked for cholesterol, and, the list of numbers. Is pretty lengthy of all the things.
That would be another what the hack is that people wait until it actually starts to show up on a piece of paper or it shows up on a diagnostic scan to start to make changes within their health. And as I described to somebody yesterday who is, and to be honest, he's staring down a diagnosis of Parkinson's. And I told him, I said, you don't need to have a nervous system that's in disarray and dysfunction as well. You don't need both. What you need is a nervous system that's going to be functioning at the highest level that it can while your body is trying to process and get through this. So
and I think we're driven by pain or pleasure, right? Because when we don't have pain, we think everything is right. So that's again a conversation we have every day. So what's your hack number 3, Craig?
I would say the number one thing. The other one I would say is have a calm perspective when you're faced with stress and adversity. Is learn to what I would say is take an overview perspective. Astronauts, when they get up into the into the universe and up into the space station actually is that they commonly describe what they refer to as the overview perspective. They start to look at how the Earth looks from such a distance, and they realize there's no borders, there's no stresses, there's no anything. And so what it does is it allows you to see both the positive and the negative side of each and every problem that you're faced with. So if you're facing stress and adversity, it allows you to start to get perspective of both things. So when you're going through a very challenging phone call, you'll notice that simultaneously it's beautiful outside, the birds are singing, and you have to be able to make sure that you're able to attenuate your senses to both the good and the bad. Mm-hmm. So that would be another one.
I call it the sometimes sitting down and going over the not to do list of things that have piled up in your life. So we have time for a fourth one, a quick one, if you would like.
This would be my big one is find the key habit that's limiting your life. Whether it's you're a smoker and you need to work on getting rid of that. Yeah.
This is where the book comes in with the Hack Your Health Habits, because I'm sure you're going to discuss habits are so key, right?
Yeah. Like maybe if you do have poor sleep, you need to get help with that. You need to figure out what it is that's interfering with your body's ability to get into a deep, restful, restorative sleep. Maybe it's diet. Maybe you need some counsel on nutrition, or maybe you need some maybe you need to surround yourself with people that celebrate you and not tolerate you. Maybe your social network needs a bit of a culling. Maybe you need to unfriend some people.
Overhaul.
Maybe you need to friend people, or maybe you would need to associate with people that are positive and that are uplifting. I read something this morning. It's like if you have a coffee cup like you do, and it's full of coffee, and somebody bumps into you, what spills out is what's in it. And when you're faced with a crisis, what spills out of you is what's going to come out. Mm-hmm. So if you're filling yourself up with gratitude and tranquility and love and appreciation, well, when you're faced with a challenge, guess what's going to spill out? Yeah. It's not going to be the hostile kind of negative, trodden type of information or mental state. Change the way you think.
Exactly. So on that note, I like to ask all my guests if you have a favorite quote, a quote that just keeps coming back, in your life. You can paraphrase, but love to know what yours is.
It's a common chiropractic one, but we never know how far-reaching what we say, think, or do will affect the lives of millions tomorrow. And any opportunity for you to step up and pay a compliment, or to encourage a friend, or to make a phone call and connect with an old acquaintance. It just, maybe it's stepping on stage and speaking when your voice shakes. Who knows what it is, but it's standing up and stepping out so that you start to change the way in which the conversation goes.
Oh, thank you so much. It's one of my favorite quotes as well, Craig. So this was Dr. Craig Hazel. And if you would like, I did a little plug for my book here, but it is ready to be pre-ordered on Amazon. It's called Hack Your Health Habits. And if you would like the first section of the book, meaning the first 4 chapters, you can text the word hack to 716-203-1356, and you'll get the first section of the book. So for next week, my guest is going to be another good friend of mine. I just feel fortunate that I can interview all my good friends here on this podcast. Michelle Horn, who is an image consultant, and we're not just going to tell you, what color to wear and what to wear. We're going to go deep and really tackle why it's important to feel good in your own skin. And really work on our self-esteem and dig a little bit deeper. So hopefully you can tune in next week. So it's next Friday at 11. And thank you so much for watching. And I'm going to say, keep on hacking your health, because the benefits are going to be tremendous. So until next week. I'm Dr. Nathalie Beauchamp, and this is What the Hack, the podcast that dives into what the heck is going on in the world of health and well-being, explores how to optimize your mindset and your lifestyle, and shares practical tools so that you can achieve your fullest potential. Join me and a special guest each week as we discuss everything from biohacking to diet personalization to cutting-edge detox methods to setting and staying accountable to your goals. Ready to find out what the hack you can do to stay healthy? sharp, and at the top of your game? Let's get started. This has been a Wellness on the Go production.